Hi everybody, I'm Dr. Lauren Peterson, Doctor of Physical Therapy at Physical Therapy and Balance Centers of Oklahoma City. I'm here to talk to you today about vestibular migraines, kind of what they are briefly, and then really how we would treat them with physical therapy. So I have a nice poster here of the vestibular system. So a lot of people don't know what it is. It is the system inside your ear. So it's kind of right, actually almost behind your eyeball, but in your ear. And it looks kind of like a conch shell, so you can kind of see it better down here. And then this is your semicircular canals and your vestibular system. Okay, so how this works is that there are fluid in these canals, these semicircular canals, and then there are little hair follicles at the bottom. And as you turn your head up, down, side to side, every which way, your vestibular system orients you to tell you which way is up. Okay, there's also these little organs down here called the saccule and the utricle, and they are in charge of telling you when you're going up and down, bobbing and weaving, going surging, side to side, different planes of motion. Okay, so it's telling you which way is up when you tilt your head, and also if you're going up and down, side to side. Now, a vestibular migraine is when this system is not working well and you experience vertigo. So you may or may not have a headache with a vestibular migraine, but instead of a lot of times benign paroxysmal positional vertigo is when people will say there's crystals in your ears. And that's when some of these otoliths get sloughed off and get in these semicircular canals. Vestibular migraine, that is not going on, but your vestibular system is not functioning properly. So for some reason, it may be a nerve that's not telling your brain which way is up. They don't really know why, but you're experiencing these vertigo symptoms, and it's due to this vestibular system being overloaded, overwhelmed, and not being able to function properly. So this vestibular system is really the judge for your balance. And so when it can't tell you the proper way, which is up, down, or I guess which way is up, and if how you're moving, you get this vertigo experience. So with our vestibular therapy, we are using your other senses, so your somatosensory system, which is how you feel yourself in space, and then also how you use your vision to tell yourself which way is up. We are trying to slowly integrate both the somatosensory system and the visual system for our balance, either down or out of your system, and doing balance exercises so that your vestibular system doesn't have to take as much of the load. Okay, so your vestibular system is overwhelmed when you have a vestibular migraine. So we're going to do balance therapy to kind of quiet the vestibular system as much as possible and add other things to help you balance. So to use more of your somatosensory system, to actually be able to use your eyes better. So we'll be doing gaze stabilization exercises. So that is a lot of things. Actually, that's why you need to come to therapy, so we can decide which of the eye motions are making your nervous system most upset. And then we can slowly exercise those to make you better. So for example, we have something called smooth pursuits with your eyes, so that when you look at an object, you can let your eyes move up and down nice and smoothly, or side to side nice and smoothly. If we decide that you can't do that, that's something we're going to slowly reintegrate you back with therapy. So we're going to start slowly, something easy to look at, and go quicker and quicker. We take for granted how much we use our eyes when we're doing every day for our balance. We don't realize how much we're relying on them to tell us kind of what's going around us. And if your vestibular system is not functioning properly, a little bit of motion is confusing your vestibular system. So we have to figure out what your deficits are, and then slowly it's called habituation, but make your eyes used to performing that activity at a slower pace than it is doing now, and then progress it to a quicker pace as you have less migraines. Okay, so I talked about smooth pursuits. There's also saccadic eye movement. So can you bounce your eyes from object to object, side to side, and up and down? That can be a trigger, but there's actually several more. And so you have to come in for an exam and we have to see what is perturbing you. Okay, here at Physical, we actually have a whole balance paradigm. And so we're able to test all of your senses and see how well you're actually able to use your somatosensory system, your eyes, and then that vestibular system. And then we're gonna slowly start at wherever you're the most deficit on that system, and slowly load your balance system up so that your vestibular system isn't overwhelmed. So it's called sensory reweighting, sensory organization training after we do a full sensory organization test to try and not overwhelm your system and eventually allow it to be overwhelmed. But it's just like anything, like when you're weight training, you have to start at a low weight to be able to, if you had a shoulder reconstruction, you would slowly start with motion, no weight. Okay, and then you would finally, when you get better, or even with some assistance, you would do it. Then you would do without assistance, and then we'd add weight. Same thing with your balance. We want to find what your baseline level is first, and that's why you have to come to therapy so we can figure out what that baseline is. Here at Physical, we actually have a computerized dynamic posturography machine. And only the Physical in Oklahoma City and Tulsa in Oklahoma have that machine for us to figure out what your deficits really are. And that's why what makes Physical different and special is that we can establish that baseline, and then slowly we have a program that loads your system into whatever. If we need to work on your somatosensory system, we'll work on that first. If we need to work on your vision, we'll work on that first. And then really we'll slowly add in the vestibular component so that you can tolerate them.